Thank
Over
you.
to you.
Just want to acknowledge I'm with my two colleagues, Wendy and Erin. Maybe just raise your hands. Uh, Basically, those that are working in supply chain, I think you know what Village Reach is already doing. We have big initiatives in Mozambique and Malawi currently. We've got other works that we are doing in other countries. But at the moment, I'm going to present to you about a unique program in Malawi, which is actually trying to strengthen the supply chain at the last mile. I know there have been a good presentation on the strengthening the supply chain at the central level. In Malawi, I also have a colleague from Malawi, Abu, he works for USID. We sit together in the technical working group, we co-chairs, and for sure we are fighting very hard to make sure that our central level is also strengthened. But at the last mile, there is this initiative that we are actually making, Village Reach. That is, we are introducing an enhanced cadre of pharmacy assistants to improve dispensing, availability of medicine, uh, basically, and also the information management at the lower level. Basically, just to give you a snapshot of the whole initiative, an assessment was actually made. I think some of the participants here were participated in the assessment that was conducted. I think JSI and some members of the USID Deliver Project participated in the assessment that was actually done in Malawi. And after making assessment in terms of the supply chain and also the human resource in supply chain, after the assessment was done, gaps were identified. After these gaps were identified, the strategy was actually put in place to make sure that the gaps that were identified were covered. So one of the strategies that was actually developed was this initiative. That is you will actually see from the presentation that it was really necessary to come up with this. Yes. If you look at the structure, it's not very different from most of African countries. You have central hospital, which are like referral hospitals. You have district hospitals. In some countries are provincial. You also have health centers and community uh, hospitals at the lowest level. In Malawi, at the central level, we have pharmacists and pharmacy technicians who are actually managing at that level. At the district level, we have the pharmacy technicians have the diploma. But at the lowest level, that's at the community level, you have nobody. And at the community level, at the health center level, that's where most of the population is. I'll tell you that Malawi, over 60% of the population live in rural areas, and that's where people are. So that means that 60% of the population are denied the immediate service of trained personnel. So this is one of the gaps that was actually identified after that assessment. You can look at that picture uh, on that presentation. That's the picture that we have and we have had for most of the health centers where you don't have a very proper way of managing stocks. If you look at that, I think it's very difficult for you to manage data, to correct proper data. It's very difficult to know where what is for sure. The RMIS report is never accurate. As a result of that, because you don't have proper inventory and actually the data cannot be properly be presented, stockouts are inevitable. The main reason why we've had that is because we don't have proper people undertaking those tasks. I would, you do think it's an exaggeration if you come to Malawi if I tell you that in some health facilities, cleaners are the ones who are undertaking dispensing. In some cases, you know, well, I'll not go to the clinical, but just know that in most of the cases, actually sweepers, they would sweep, then stop sweeping, go and start doing the dispensing. That's how dire the situation is. So this is what actually necessitated this program to come in. So USID and the University of Washington, the Global Medicine Program, are the ones that actually came up with the funding for this project. So Village Reach, in collaboration with the Ministry of Health, and the only college that trains lower level pharmacy technicians in Malawi, the Malawi College of Health Sciences, came up with this initiative. In Malawi, we have got 650 health centers, not mentioning the community or health posts or other community clinics that are there. We have 650, but at the moment, the initiative is the 3-year program, and we are training 150 students at the moment. So you can still see that the gap is still enormous. It's a very big gap that we still have to cover. Our target is that by 2020, we should have a pharmacy assistant at every facility. So those of you who have got cash to help the rural areas, you can come up and join us in this initiative. Basically, what we are trying to do, the intervention is going to, we are saying we are going to place this pharmacy assistant in these health centers. And we are expecting that all the challenges that I highlighted in the beginning are going to be addressed immediately, because the structure of the program is that the students, we actually, after we revised the existing curriculum that was there, so that there should be a very quick balance. There should be a good balance between theory and the practice. So there's 50% of theory and 50% of practice. So immediately we're expecting that these problems are going to be addressed. But the overall impact is that there's an improvement of health outcomes, and lives are saved, just like what everybody has actually agreed in the previous presentation. So as I've already alluded, that we did a revision of the curriculum to make sure that there's a good balance. And as a result of that, because students are pressed in the facility to learn the practical aspect of how they can manage these stocks, the facilities where these students are placed are already getting the immediate results. We've already seen a great change in terms of stock management. I think you can see behind the movement from where I showed you to what I'm showing you. There is a picture of a lecturer and one of the students who is being trained in this program. So the other advantage is that students are being prepared to go and work in the rural, remote areas. So they are facing the real situation where they are going to be working in. One of the health workers actually brought up a testimony saying that through this program, our health center receives one student who has already received training in the area of dispensing and inventory management, more training than any currently working at the health center, including myself. So this is a very unique initiative. If you want to speed up the, come on, it's gone. Okay, thank you. If you want to speed up the integration of these health workers or those that are going to strengthen the supply chain, please take this approach. It's very, very practical. That's a display of the immediate results that we are actually getting from attaching the students in the health centers. The students were attached for 20 weeks, which is like 5 months, and we took data before they went to the health centers and took data after completing the first 20 weeks, and we've seen a lot of changes and positive development, as you can see from that graph. So One of the most startling testimony is that one of the health, I've got 2 minutes, okay, thank you, that's enough. I am completely, one of the health worker, a clinician, I am completely relieved to have this additional workload of dispensing and inventory management taken over by those specially trained to do the job. I am no longer dispensing or dealing with supply chain issues other than approving issues and orders. Now I am able to see more patients in a day and provide more thorough examination. This program is a big relief to us clinicians working in the rural and remote health centers. I am getting calls from federal health center in charges who are inquiring about how they can get one. This is one of the things that we wanted to achieve, so that the tasks that are being shifted from actually the logistical tasks which are being undertaken by clinicians goes back to the people that are specially trained to undertake. And this is one of the things that each and everybody should do. Actually aim to achieve. In conclusion, I would say a pharmacy personnel at the health center level can bring forth significant benefits to the health system, especially in rural areas in Malawi. Training of pharmacy assistants addresses staff shortages by shifting logistics and dispensing tasks away from currently overloaded clinicians. We anticipate impact and evaluation results to demonstrate and improve access to uses of medicine. And then lastly, I would say other countries should consider this approach to training health personnel, because it's the most effective and most efficient way. Thank you so much.